North Atlantic. It's late spring and it's still pretty cold out. My grandmother used to always tell me to bundle up or I was going to get sick. But what does it mean to be sick? Is it your kid that's home from school with a sniffle? What about their grandparent that has osteoporosis? Well, if someone has cancer, they have to be sick, right? But then there's people that suffer with mental health conditions for their entire lives. Well, the reality is there's lots of ways we define being sick. And according to the Global Burden Disease Study, 96% of people in the world have at least one medical condition requiring medical attention. Meanwhile, 1/3 of the world's population has at least 5 medical ailments concurrently. I'm a professor now, but in my former life, I used to work with companies to improve the health of their workers. Now, I once met a guy we'll call Joe who worked in a shipyard. Now, Joe was like a lot of us and thought he was healthy because he was told he wasn't sick. Let me explain. In order to get a job with these companies, you have to pass a medical, at which point you're deemed to be healthy enough to go to work, and you have to do these every few years. Well, Joe worked for one of these companies as a crane operator. His job was to lift several ton containers hundreds of feet in the air over his friends working below and then load them onto container ships. It's a really dangerous job. Now, one day, Joe's eyes started getting bad. His glasses didn't seem strong enough and his vision was getting worse really quickly. Now, at no point did he think he was getting sick. He just thought there was something wrong with his vision. So he made an appointment with an optometrist to get a new prescription. But what they told him wasn't good. He was told he had developed a condition called macular edema, which was strongly associated with diabetes, and he should go check his doctor right away. Now, let's just remember that less than a year prior, Joe was deemed healthy by a medical. When Joe went back to the doctor confirmed these suspicions. They told him that in the last year he had become severely diabetic to the point it was causing this vision loss. His cholesterol had also skyrocketed, his blood pressure had gone up, and he had developed hypertension. When all these conditions are put together, it was determined he had developed a condition called metabolic disease, which is strongly associated with diabetic complications, fatal heart attack, and stroke. Now, for a bit of background, Joe was middle-aged, he was obese, he had a self-admitted poor diet, and he never exercised. So he had all the risk factors to these conditions. But what had happened was his previous medical had given him a false sense of security. That clearance had made him think he was healthy, when in reality, he just wasn't sick yet. The reason I use the case of Joe is that he's like so many of us, and that's because we're taught that health is binary. We're either sick or we're healthy. But even if we're part of that small proportion of the population that's free from disease, that only means at this moment. Our health status can change from day to day, month to month, and year to year. Health is a continuum. It's a lot like a thermometer. And if there's one thing we know here in Newfoundland and Labrador, it's how to read the temperature and judge the weather. We all know that at 15 degrees Celsius, we're wearing shorts. And at 0 degrees Celsius, we should probably drive slow because it could be icy. Each degree in the thermometer gives us a piece of information that we can use to make decisions. So, like a thermometer, our health can change. But unlike a thermometer that only goes up and down, our health can go in many different directions. We start running into problems when we go to the doctor to check our health status or to find out what the temperature is. That's because only 2 in 5 Canadians have the ability to obtain, understand, and then act on the information they're provided by their doctor. Meanwhile, 1/5 of Canadians don't have access to a family doctor at all. That means that 60% of us have no idea what our health status is, and even if we're provided the right information, we don't know what to do with it. For most people, trying to understand our health is like trying to understand the smell of the color 9. So how do we fix this problem? Well, the good news is that even a little bit of information can be really powerful, and that is called health literacy. Health literacy is defined as the degree to which an individual has the capacity to act on and understand basic health information in order to make appropriate health decisions. And it's amazing we can do with just a little bit of the right information. Here's an example we all know. For many of us, buying a house is a huge goal and an even bigger investment, so we value it. If we're buying a house, we get it inspected. If it's losing heat, we'll insulate the walls or we'll replace the windows. If the roof is leaking, we'll fix the shingles before the rain ruins the ceiling, and after a big snowstorm like Snowmageddon, we'll spend hours or days digging it out. It's because we feel like we can't let it deteriorate. We have to value it. So why is it that we value our homes so much and not our health? Well, it's because quite often our health isn't valued until it's lost. Now, if you ask me how I would start to fix this, I would tell you to start here because I work with people's physical health. And our physical health changes throughout our life, so it only makes sense that we should continually learn about health as it relates to our life circumstances. Now, if you haven't noticed, this health is basically absent from our community and public health education. The last time most of us learned about health was in middle school, and it was about getting pregnant and our voices changing. Take our buddy Joe, for example. He now knows that he has to eat better, so he goes online to do some research. Well, here's what Joe's going to find out. He's going to find out, I can't eat fruit anymore because it's got fructose, which is bad for my diabetes. I can't eat fats because it'll increase my cholesterol. If I have too much protein, it's going to damage my kidneys, but it's still better than sugar, which is going to increase my blood glucose, so I guess I just won't eat. But then when you don't eat, your body goes into starvation mode, which causes your metabolism to drop, gain weight, and amplifies all your conditions. It's confusing, right? Well, you're not alone. This is a common predicament for people looking at improving their health. And that's because the majority of wellness information that's readily available is typically unregulated and often provided by somebody who has an agenda and trying to sell us something. Meanwhile, our qualified personnel are overburdened by the barrage of patients already in the healthcare system. Now, just as important as improving our wellness knowledge is identifying the invisible barriers that keep us from achieving good health. That's because there's both physiological and social determinants of health. Our health is determined by a variety of factors, including our life circumstances, our workplace, our environment, and the social and economic factors that influence our lives. Research shows that these social determinants of health can be just as, if not more important at predicting our long-term health than our wellness choices and even our medical choices. That's why we all know we should exercise more and eat better and get more sleep, but we can't. It's because there's very real barriers that keep us from doing this, some of which are more challenging than others. Maybe it's cultural, like the case of Joe, whose poor health is very in line with the poor health of his community. Or maybe it's a single parent with a tight food budget and very little time to exercise. Or maybe it's somebody who's addicted to the foods that make them feel good, but ultimately make them sick. These are all valid reasons, and in many cases extremely limiting. But this is why health literacy becomes so important. It provides us with a toolbox that allows us to be adaptable. So why do I feel this way? Well, I spent 25 years of my life working in the world of wellness and 16 years in university, and guess what I found out? I found out that people that make small changes in their health typically get the exact same results as people that strive for wellness perfection. With the added benefit, they're able to sustain these changes over time. The resounding takeaway from my research was that with basic wellness education, people could make informed decisions around their health. This could be changes to their diet and exercise and lifestyle based on their personal, physical, social, and economic challenges. The results seen by these people were typically the motivation they needed to continue to improve on their own. The saying, "Don't let perfect be the enemy of good," couldn't be any truer for health. So this isn't about us solving all the health problems facing our communities. It's about us finding out where we fall in the continuum of health, evaluating what we can do better, and improving our health. Now, you may not know how to improve your health literacy. You don't know where to start. That's okay. That's why I'm here. So here's what I challenge you to do. Next time you go to the doctor, ask questions until you understand what they're telling you. If you've had an injury for a long time and it's not getting better on its own, then find someone to help you heal it. If you have risk factors, find out what they are and how you can reduce them. Start to do simple things to monitor your health, like count your steps, how much water you're drinking, how much you sleep, and what foods you're eating. And if you think you're already healthy and this doesn't apply to you, then revisit your definition of health and see if it needs to be updated based on your current life circumstances. And while you're at it, go get a checkup and see where you fall in the continuum of health. Know where you stand and what direction you're moving. Don't wait until you're sick to make changes, because it's easier when you're healthy. Now, if you're struggling with your health, then here's a bit of hope. Remember my buddy Joe? Well, he found out what was wrong. He found out what he had to do. He made small changes, and he got support for areas that were barriers for him. And ultimately, he was able to control his health and get back to work. Our health changes by degrees, just like a thermometer, not only throughout each season of our life, but sometimes unexpectedly, like stormy weather. This doesn't mean we're not going to get sick, just less likely to be. Health is a continuum. It's always changing. But the one thing we can control is knowing where we fall in that continuum and what actions we need to take to move in the right direction.